Jenn Fernandez is going to talk to us a little bit more about why is it that movement makes a difference. But I'm actually also going to stand up because I know she's going to demonstrate just a couple of things that'll help us. And these come from her physical therapy practice. Is a certified lymphedema therapist, which is edema that specifically with the lymph nodes, and that can be a fairly frequent side effect of cancer treatment. So part of the reason that I wanted her to demonstrate these um, is to help make it real. But another part is because, at least around me, it seems like so many of us are in the habit of just work, 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 go, 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 and not stopping and moving and taking a break. Um, and not, there's more than one way to take a break. It isn't just flop over on the couch. Um, so I'm one of the reasons I'm so appreciative of Jenn's expertise on this is because it will help us move our bodies some, use a part of ourselves that has been kind of sitting on the back burner while we sit here and talk. And like I said, I'm going to stand up and I would am excited to bring on Jenn Fernandez to help us with physical therapy and movement and how that can help our health and our treatment outcomes and just the way we live our lives. So I know you're here, Jenn, but I think they're probably in the middle of bringing you up. Hello, it's good to see you.
Hi, good
You're,
to see you too.
yes. So I have been really looking forward to this. I appreciate you making time in your busy physical therapy practice to do this for us.
Yeah, my
Um,
pleasure.
and I wonder, well, actually, before you just launch in, I sort of referred to it briefly, but could you say a little bit more about your background in physical therapy and oncology?
Sure. So I've been working in physical therapy for over 25 years, and about 19 years ago, started working with oncology patients and just really enjoy working with that population. Have found that there is a lack of resources for those patients and definitely a lack of lymphedema therapists in the area. So I have gone on to do a lot of education and training and become a certified lymphedema therapist. I'm also an oncology rehab therapist and just try to combine all those things together with my experience in orthopedics to help patients kind of navigate the changes that their body goes through once they're diagnosed and undergo, chemo, radiation, surgery, and then just once you survive all of that and your body's not the same as it was, kind of educating people and empowering them to get back to their highest level of function.
Yeah. Yeah, and I have to say that the physical therapy that I had the opportunity to participate in really did make a difference. One of the things that you mentioned as we were talking ahead of this session was just how sometimes it's like the timing could be different. There might have been more times where if I had known to ask, that a little bit of additional support would have helped me even more. So,
Right.
anyhow, I know you have a lot to share with us, and I don't want to take up too much of your time. So please take it away, Jenn.
Right. So I just wanted to start first by talking a little bit about the role of your lymphatic system. And so our lymphatic system is an important part of our immune system, and it's made up of a network of tissues, vessels, and organs. There's about 600 lymph nodes throughout our body, and these are all filtering the lymph that comes through the system and cleaning it up, getting rid of the damaged parts that we don't need anymore, and then returning the clean fluid back to the heart to go into circulation. And our lymphatic system has three main goals, and it functions. And the first is to fight infection, get rid of the toxins and waste products, other unwanted materials that are in our body. Also to transport fluids back to the bloodstream. That's a really important part about maintaining fluid balance. And then also absorbing fats from the digestive tract, which are too big to be moved into the bloodstream otherwise. So the lymphatic system takes care of that. And then talk a little bit about lymph. So what exactly is lymph? So the body moves about 20 liters of plasma every day. So that comes from the heart through the arteries, delivering oxygen and nutrients to all the cells and tissues in our body, and in exchange taking their waste products. And then once that gets down to the capillaries, the fluid, the molecules that are too large to go directly into the veins leak into the interstitium, so the space between the blood vessels in between all of our tissue. And those molecules, a little too large to be absorbed back into the veins, get picked up by the lymphatics. And so that's fats, waste products, bacteria, viruses, all of that filtered through the lymph nodes. What can be gotten rid of is excreted, what's cleaned and then returned back to the heart. And that's about 4 liters a day of plasma that gets picked up by the lymphatic system. Also, hormones are in there, fats, so lots of things that we know about but don't know how they get moved around. And so then lymphedema happens when there's more lymphatic fluid than can be transported by the lymphatic system. So there's a certain amount, we call it the transport capacity, and that's the amount of lymphatic fluid that your lymphatic system is capable of transporting. And then the lymphatic load is the amount of lymphatic fluid that needs to be moved. So in a normal healthy system, the transport capacity is about 10 times what the lymphatic load is. So we get fluctuations, and those are taken care of, and we don't even know about it until there's damage to the lymphatic system. So with cancer, that usually happens with surgery, radiation, and it takes down your transport capacity. And this can lead to lymphedema, which is a swelling in a part of your body that is a protein-rich fluid. And that fluid, being rich in protein, opens you up to a higher risk of infection. So that's why kind of knowing what to look for and knowing how you can reduce your risk is an important part of kind of your recovery from the cancer treatments that you have.
Yeah, for sure.
So,
okay. I thought I knew some things.
It's a lot of information. I know.
Yeah.
So then this takes us to kind of the more practical part, which how can we keep our lymphatic systems healthy and lower the risk of developing lymphedema if you, in fact, have had damage to your lymphatic system? So most people don't develop lymphedema once they've had surgery, radiation for cancer, but some do, and we don't know who's going to develop lymphedema. It most frequently happens within the first year after you finish treatments, but it can happen, 5 years later, 10 years later, 20 years later. So you're at risk for developing lymphedema if you have had any sort of surgery or treatment that has damaged your lymphatic system. So kind of some of the things that you can do to monitor your risk is to know what your at-risk body part normally feels like. So for instance, if you have breast cancer and you've had lymph nodes removed, you want to know what your normal arm feels like so that you can monitor for signs and symptoms of lymphedema. And the most common signs and symptoms are what we call heaviness, achiness, fullness, numbness, and tingling. And you will feel these before we can measure them and before it's what's known as clinical lymphedema. So, for instance, if you have like a really busy day and you're carrying groceries and doing laundry, and then you go on a big hike, and the next day your arm feels kind of achy and full and heavy, this is your body's way of telling you that you have increased your lymphatic load and is getting close to the transport capacity. And so it's time to kind of back off a little bit and give your system time to catch up to that increased fluid that you have introduced. Also, avoiding infection. So, bug bites, scratches, things like that. If you get them on your at-risk limb, you want to just keep an extra eye on them, wash it really well, monitor for signs of infection, because again, since that lymphatic fluid isn't moving through there as easily as it should be, you are at an increased risk of getting an infection. So just monitoring for that, protecting yourself from that. So wearing gloves if you're doing gardening or dishes or activities that might be a little bit more rough on your skin. Using bug spray to avoid bug bites, sunscreen, just protecting your skin, keeping your skin well moisturized, eating a healthy diet, drinking enough water. Some of this probably ties back into what Donna was saying about the nutrition, but keeping your body well hydrated and your skin in good condition will also lower your risk for developing lymphedema. And exercising regularly, movement really helps to increase the rate at which our lymphatic vessels contract and the transport rate of the lymph fluid in our body. So maintaining a healthy weight, healthy diet, enough sleep, kind of all the things that we know that we should be doing to take care of ourselves really impact our lymphatic system.
Okay, that's good to know. I often find that if there's something that I know I should be doing, I might have trouble getting to it if it's only got one benefit. But if I can say, okay, with this one thing, I am helping, my digestion and my lymphatic system and my energy level, and then,
Right. Yeah.
as those pile up, my frequency of actually doing it increases too. So,
Absolutely, absolutely. And I think when it really is any movement, right? So the lymph vessels on their own contract about 6 times a minute, but with deep breathing and exercise, we can increase that up to 18 to 20 contractions a minute. So you can really increase the rate at which the lymphatic fluid is moving and filtering all the toxins out of your system, getting fresh oxygen and blood flowing to all your tissues and organs by just moving. It doesn't have to be intense movement, just moving more. I think we don't move enough in our daily life. And I know I obviously in my profession, I am moving constantly, but I know that a lot of my friends, especially with COVID, now work from home and do all their meetings over Zoom. So they're moving even less. So, it's as simple as even when you're sitting in a meeting, you can be doing some seated calf raises or extending your legs up and down, or in between meetings getting up and moving around a little bit. And just little bits of frequent movement throughout the day can really make a huge difference.
Okay. So there might be especially good movements, but even to just get up for 3 minutes and stretch, in
Absolutely.
whatever way feels good.
And in whatever way feels good. And I usually say, think about the position that you have just spent the last, 30 minutes, 60 minutes in, and move opposite. So if you're sitting on a meeting or on your computer, just, standing up and extending your arms back and looking up for a minute and rolling your shoulders around, gets that lymphatic fluid moving, and it really helps. So there's, I can give people a million different exercises, but it's really just finding ways that feel good to you and moving in the opposite direction that you just spent your last period of time in.
Okay. Yeah. So instead of over the computer doing this.
Exactly. Yeah. Yeah. And you'll notice a difference at the end of the day too. You won't feel as tired and sore, and it really helps.
Yeah. Great. Okay. So sorry for interrupting. I'll let you go
No,
back to your
no.
plans.
I mean, that was, I think I covered a lot of the stuff is just keeping your lymphatic fluid moving. So full range of motion through those joints. So if your at-risk limb is your arm, you want to think about all the joints in your arm. So like start with your hand and like fully close and fully open your hand, and do like
Okay.
5 to 10. And again, this can be done, in line at the grocery store while you're on a meeting. So open and close your hand and then move to your wrist and just, full joint range of motion. There's the deep lymphatics inside of all of our joints. And so doing full range of motion through those joints stimulates those lymph vessels, and that moves the fluid back towards the heart. So your wrist and then to your elbow. So if you extend your elbow all the way and bend it all the way, and just kind of move up the arm. If this is good for anybody, but specifically if you have had any injury to your lymph nodes in your axilla, if you have like a gynecological cancer or in the abdomen, then you could do this with your feet. So ankle pumps, knee flexion and extension, hip circles, and then we said just circling your shoulders around. And then another one. And all of these, if you can stand up from your computer, you can do these all in standing. But then one more is if you bring your arms out straight in front of you and then open one like you're opening a book, and then go the other way.
Ooh, that's a nice stretch.
Yeah. And that, again, there's a lot of lymph nodes in the spaces between our ribs and in our spinal column. And so doing this rotation there helps to just get more deep lymphatic drainage, which keeps everything moving and keeps us healthier. So,
Mm-hmm.
and
Okay.
then just the last part I have, and then open to any questions, is how do you know when you need to go see a physical therapist or a certified lymphedema therapist? And it's if you feel those symptoms, the heaviness, achiness, fullness, numbness, tingling, and they're not getting better when you back off of the activities that seem to be causing it, then it's time to call your doctor and say, I think I'm having some signs of lymphedema. I need a referral to see a lymphedema therapist, because then we can kind of assess you individually and come up with a treatment plan to kind of treat the symptoms that you're having and educate you on how to monitor that going forward.
Okay. Okay, great. And while I'm waiting for that appointment, some of the exercises that you just gave, and on the internet, there are things like doing massage this way, I think it is. And
Yeah, so you
then,
want to move the fluid back towards your heart, and
okay,
the lymphatics are fairly superficial. So it's different than a traditional massage that people are used to. So you really it's a skin stretch motion. So not a like massaging your muscles. So it's just a skin stretch. And that is something that is best taught by a lymphedema therapist before you start to do it on your own. So doing like some deep belly breathing and just exercise, moving your body and backing off from the activities that got you to feel those symptoms are your best bets before you see someone.
okay, okay, good. And don't necessarily jump into everything that they show you on the internet, at least not
Right.
without some training.
Yes, I mean, I would say if it's movement based and breathing based and it makes sense to you and it makes you feel better, then, it's fine. But yes, I wouldn't invest in any, expensive equipment that's supposed to fix it for you.
Yeah. Yeah, often the expensive equipment solution kind of takes yourself out of the picture in a way too.
Right.
Um, so I think it's often better to make a change. I don't think we have the link for your gift yet. So I know that there's a little bit of a boost for people and it'll have some of those notes too from what you just said of what to do and when to call. Uh, but if we could share your contact information. Uh,
Yeah,
and
sure.
and this has been um, super helpful. And like I was saying earlier, I did the cancer thing myself back in 2016 and into 17. And then it becomes a community. So I've been chatting with a bunch of people ever since and figuring out more and more what can I do to be supportive of that. So yeah, so it, and I'm forgetting where I was going with that, but except along the lines of moving is helpful and finding folks who know what they're talking about and can help you bring it into your real life in a real accessible way uh, is super helpful. And um, I so appreciate your profession and not just myself, but just about everybody I've talked to who has been through surgery, especially. I never knew about the radiation part, so I don't think I've thought to ask. but, um, but yeah, it makes a real difference. So if you're in the middle of uh, an experience that sounds like what Jenn described, uh, it's worth reaching out to her um, and potentially talking to whatever your health insurance and providers are about what they have available for you as well. Um, thank you so much, Jenn.
Yeah, you're
Um,
welcome. Thank you.
and since you're not too far from me, I'm hoping that sometime maybe later this year we'll have the chance to actually meet. I'll come over your way because I know how
Yeah,
busy you are.
yeah. Sounds great. Sounds great. Thank you.
Hey, thanks, Jenn.
Bye.